and it's going to be a nice conversation.
Okay.
One, and we're live with Miami's Community News. Thank you for joining us. And folks, this is going to be a tough one here. Our guest today, an expert, is Dr. Pronounce your first name?
Kunjana.
Yes, exactly. And Mavunda. Did I get that right?
Mavunda, yes.
Okay, I'm only going to say that once. That was it. I'm going to read from her bio, folks. Oh, here we are over here. This is really impressive. You're a pediatric pulmonologist.
Yes.
That's here, okay, with extensive clinical and research experience, has provided care to infants, pretty important audience there, and children in many different settings, and has been practicing since 1987. And you are a expert on travel medicine. So if you guys are traveling, that's not like to Hialeah, all right, or in South Miami, this is overseas. You need to check with some of your doctors, say, this is where I'm going, what do I need to do to protect myself? Obviously, the biggest rage right now, especially unfortunately with COVID on the increase, all right? That seems to be pretty massive, all right? So we'll talk about that a little bit later. But you brought some things. So why don't you tell us what you brought and why you brought them and why this is important to travelers?
So if you don't mind, I'll start with a little story. My daughter had moved to New York when she was working in New York. And in the winter, it would be cold, but they would have to take the train, and there was always exposure to a lot of people on trains. And she would sometimes get quite upset because the trains would be crowded, and there were people who were coughing and sneezing in very close environments. So I had made her packages with like these clear packages with masks, hand sanitizer wipes, and Clorox wipes. This is a little bigger than what she had, but I had made those for her so that she could keep them in her purse. And if she was in a situation where she was exposed to coughing and sneezing, where respiratory viruses such as the flu, COVID, whooping cough, etc., get transmitted, she could just put on the mask and use the hand sanitizer wipes in crowded areas. Because people cough. Now we're good about masks and hand washings, but before COVID started, people would cough, sneeze, maybe touch their face, the germs would be on their hands, then they would touch a surface, the surface will get contaminated, and there are certain germs that can stay on the surface for a long time. So she was like not happy with me that I made her these things. But
when was this, by the way? When?
This was actually more than 10 years ago, before the H1n1.
Okay.
So it's been a while.
So for the novice like myself, 10 years ago, oh, no, that's not going to happen. You don't have to do anything. Maybe you wash your hands every once in a while. We weren't worried about surfaces. By the way, whenever anybody comes in the building, we take their temperature, clean their hands, and have masks, which are right here. And also there's a big glass thing between us. Okay.
Right.
So 10 years ago, you were doing this.
Yes. And that's because of what I had done when I was at the health department.
What did you do at the health department?
I was director of epidemiology and disease control. And we would investigate different diseases. People, Miami is such a center between north and south, and we have population from different parts of the U.S. And people are used to going to their country, Central America, South America, just getting on the plane and leaving. And for example, the flu. Influenza, there's so many different strains that circulate around the world. Even within the U.S., there may be different strains in different states. But then when you have a person from the northern hemisphere going to the southern hemisphere, they'll be exposed to different strains. We may not have outbreaks here or the prevalence of flu in our community, but down south they would. So then they would come back sick. Or they would bring things like typhoid, dengue fever, different things.
Would you like some espresso? Denise has brought us some espresso.
So by working at the health department, and I also had the opportunity working with the CDC people, because we had certain outbreaks that we needed the CDC to come in and help us figure it out. So for example, the first norovirus outbreak that we had in a cruise ship was in Miami. And we had a team of CDC people in a room like this, but twice the size, with desks, phones, people working the phones to figure out what was going on. So having worked in the health department and being a pediatric pulmonologist.
Which health department? The one here?
Here, Miami-Dade.
Okay.
And being a pediatric pulmonologist, I'm very aware of germs, especially germs that are transmitted by hand-mouth, droplets. Droplets is the way that most germs are transmitted, but some of them can be airborne, like tuberculosis. So just because of that, I've been cautious.
Folks, this is a very heady conversation. We're all trying to absorb it, so go on, doctor. Okay.
And then what also happened is with my travel medicine and my international travelers, when they would, especially if they were traveling to Asia or something, I would always ask them to keep a mask, hand sanitizer wipes, and possibly Clorox wipes available so that they could use them in areas where they were crowded, or, for example, in cities that are polluted or where the tuberculosis rates are high. People would cough, and then those things can be transmitted. So it was funny because I had these packages made to show to the travelers. And then when COVID hit, there was such a shortage of masks and wipes and things. But fortunately, I had these things in the office already, so it was okay. But anyway, so I brought these things to just show a couple of things. One, alcohol sanitizer has to be 60% minimum alcohol, 75% is better. Most people use the hand sanitizer liquid. And something that I worry about is I would have parents with hand sanitizer bottles stuck to their the baby's stroller or something. And every once in a while, they would open the bottle, wipe their hands, and then close it. But that bottle has been exposed to the environment. So you're contaminating your hand when you open it, and you contaminate it after you use it. So one of the things that I prefer, especially for kids, is to let them have hand sanitizer wipes. Because the advantage with the wipe is that you basically just clean and wipe and allow the alcohol to dry so everything dries up. And I brought this because I keep this in the console in my car. It's closed. I don't have to touch it. I get into my car. First thing I do is open it, take out the thing, wipe my hands, wipe my key, maybe the handle of my purse, and then start the car. So hand sanitizer wipes are important, and you can get different sizes. So whenever you're traveling, whether you're in a car or in a plane, in a crowded area, hand sanitizer wipes are helpful. The other thing I wanted to show you is masks. Everybody wears masks that are made of fabric now because that's most practical. We have to remember that the fabric mask has to have a minimum of 2 layers. If it's 1 layer, the germs can go through. So 2 layers are better than 1 layer. The other thing that is important is to have the ear loops adjustable, because you want the mask to sit tight so that you don't have to keep on touching it. And you also want something that holds onto the nose so that there's a seal, there's a nice seal. Often I will see that the loops are not tight so that the mask is falling off. Then you're losing that seal, and you're constantly touching the mask. So you might be contaminating the mask with the COVID and therefore contaminating yourself. So masks with loops that are adjustable are ideal.
Would you show that again? How you when you tie it like that, so you can
Yeah, so see the loops?
so you can
So
go.
you can, yeah.
So what is that? That is a little doohickey
It's
on
like
there.
a plastic thing. And then there's this area above for the nose is a little bit firmer than the rest, so that there's no leaks. Surgical masks are actually better than the cloth masks.
And why is that?
But those are harder to get sometimes, and then they have to be changed frequently.
What is
Some
frequently?
people recommend that if you use the surgical masks, to have 7 masks and then to have a clean bag available. So at the end of the day, you put the mask in a clean bag, let it sit there, and rotate those masks. But eventually, the loops do get loose. And something else that I've noticed is that you have to be careful where you get them. So this is supposed to be a surgical mask. It looks like a surgical mask. I got this on Amazon, and it's not really as good as a proper surgical mask. So we have to be careful about the products that we buy and make sure that they're not as good quality
What
as
about the
it should
material?
be.
Sometimes when I wear, I'll call it a surgical mask, I'm going, what is it that I'm feeling in my nose?
It's the humidity from the nose and the mouth. And for example, when I go for a walk, I can't wear the fabric mask because it's such a good seal. But then I'm walking and I'm breathing more, so that the moist air from the nose and the mouth and possibly the sweat just make it moist and very uncomfortable.
Lots of times we see the news reporters out doing stories, and you see them after about 30 seconds. They're constantly moving because their jaws are moving, and of course the rest of it's going to move.
Yes.
Right?
Yeah.
And one of the things that I've recognized when I'm by myself and I'm doing, it's perfect. But as soon as I start yapping this thing, it starts slipping. So what we're doing is we're taking our hands. By the way, we clean the desk here with
Right.
disinfectant all the
Right.
time, and especially this because I know that we touch this. So if you're touching at something that might be disinfecting, and you touch your mask, so you brought that closer to you,
Yes.
right? Which is actually we're learning how to keep our hands away from our mouth.
Right.
Well,
And that is that, it's like we're so used to touching our face, so we have to consciously remember.
And all those
to
little
try
kiddies
not to
that want to
touch the
spit all
face.
over us when they kiss us, all right? And you go, wow, what do we do about that? So tell us about the moms and dads with these little kids, all right? And the parents are actually a little more exposed than their kids. So how do you do that? My kids are grown, so
So that makes it a little bit harder. The thing to remember is that young children do not transmit the virus. They don't have strong enough voice or force that they don't transmit significant amount of virus. So that's one good thing. Parents have become quite creative about finding interesting masks that the child is willing to keep. But the other thing is a shield, the plastic shield. And again, there's some very interesting shields. Like I went to Ace Hardware the other day, and there were some really cute shields for kids. So you shield the face if you can't wear the mask.
okay. Let's talk about kids' medical services. You're there, you treat kids. That's what you do,
Yes.
right? You're a
Yeah.
pediatric pulmonologist.
Yes.
And this disease starts here, right?
Right.
So what is that like, looking at these little kids and trying to figure out where they are and being so close to them? What does that look like? And by the way, Cyrus Jefferson says hello. All right. Hey, Cyrus. All right.
So this is why masks work. I've had patients in the office with COVID. For me, like my first baby that I saw was a premature baby who had been on oxygen, who was still on oxygen, weighed like 8 or 9 pounds, tiny. And mother was really good about isolation and stuff, so she doesn't know how the baby got sick, but the baby got sick, got the COVID. And the baby, fortunately, the baby did not get very sick. He was in the hospital only overnight. And then from the hospital, they came straight to the office because I needed to give a special shot to that baby. And I was not so worried about the baby as I was worried about the parent, because you had to know that the parent had to be infected. Even though she was asymptomatic, she was infected. So what we do in the office
in the offices of kids.
Yes.
Yes, okay.
In the office, we keep all the doors open. That way, except for the front door. That way, the parent comes in and goes directly into the room. We don't. If they'll use the hand sanitizer. If that's by the front door. We haven't really been testing their temperature every time we come because we want to not have as much exposure, to minimize the exposure that we have to people. So we have them come straight to the office, straight into the room. And like for this baby, I had everything ready. I had told the mom, call me as soon as you leave the hospital. I'll have everything ready. And in our most doctors' offices now, we have to be really careful about the scheduling. Whereas before we would have people in the waiting room, now we can't. We have to schedule in a way that the patient comes into the room, gets in, and leaves, so that there's as little exposure as possible. And I'm fortunate in my office that I have 2 doors. So they come in through one, leave through the other, so there's as little exposure as possible. So anyway, with this baby, everything was ready. I took care of the patient, did what I needed to do, and let them go. So little babies, of course, they don't wear masks. The baby was not coughing. I had no exposure. Mom had the mask on, and I have my mask on. And with all these exposures that I've had, I actually just checked my antibodies yesterday. Because you know that there's asymptomatic COVID.
Yes.
So I was thinking that I had to have COVID at some point. But I'm negative for antibodies. So masks, hand sanitizer, soap and water, distance, all of those work.
So some people have checked in. I just want to say Christy Berry, Juan Leonard, Mr. Bracken, Anna Brandt, Omar Diaz, Miss Massey, I can't pronounce your first name, sorry, David Singer, Tatiana Santos, they all say hello. All right. So what percentage of the people that actually have COVID are asymptomatic?
It's hard to know, because if you're asymptomatic, you're not going to get tested. And also, it's may be related to the age. So for example, you may have children who have COVID and you will not test them, but they may have COVID. So we won't know what percentage has COVID. Young adults, teenagers, young adults, they can be asymptomatic. And unless you test, you don't know. And as we know, testing is not always available.
So asymptomatic people, they can still give that to somebody.
Yes. And
the other person can be asymptomatic themselves or show symptoms.
Yes. And the concern is if it's a teenager or a young adult that gets the virus, they may not have symptoms, but their voice is strong enough, their flow of air out of the mouth is strong enough that they can transmit the virus. The droplets can go on surfaces or directly into a patient's other person's face. And then if they're visiting grandparents, for example, or if they have parents with chronic illness, then those people are more likely to get sick and really get sick.
So one of the things I've noticed, different physicians are handling it somewhat different. There's some people in medical that wear just the standard surgical masks. In the same industry, same medical practice type business, they're wearing a full garment, right? So everybody's a little bit different, right?
Yes.
I was in one doctor's office. He said a maximum of 10 patients in the room. All right, but it was not a respiratory. It was a foot doctor. And I said, okay. So on one hand, I've been in a doctor's office where it's 1, All right. On the other hand, so we see this whole range of how people are treating it. And some people are really serious about it. We had one doctor that came over, and he actually said to me, "Why are you bothering taking people's temperatures?" And I said, "I don't know, because that's just a protocol that we just, we're doing it." So we probably taken the temperature of, I don't know, 600 people, right, in the last couple months. Zero have a temperature.
And we do ask our patients if anybody has fever, we don't even allow them in the office. We have to send them to the urgent care center.
So as a consumer of information, all right,
Yes.
it's still a little confusing, all right, and so you've been in this field for
Many years.
many years, all right, and specifically about diseases with pulmonary, all right, and then also travel. So what's your best advice to people concerning COVID, concerning their protecting themselves and their family? Do it. Say it again.
Masks, social distancing, hand washing, wipes. If soap and water are not available, soap and water is always better than hand sanitizer wipes. But those three things work, and in the past few months, we have shown that it works.
So now with COVID exploding all across the country, right now it's ticking up a little. I don't know if it's a little or a lot, but it's ticking up. Yeah, percentage-wise, it's a huge increase.
Yes.
To go from under 5 to 7 or 8, that's a gigantic increase. So there's something that's happening here. Now we know that we have the holidays coming up. People want to get together. What's your suggestion?
That's going to be tough. Like the way the numbers are exploding, it's expected that they're going to continue rising. And there was just an article, I think yesterday or the day before, that showed that the places where transmission occurs most is restaurants, houses of worship, and schools.
And what? Schools.
Possibly.
Okay.
So, and anywhere where there's too many people. So, one of my concerns is the airports. If people are going to visit family, they will be flying. And it's if there's a lot of people, it's going to be hard to do the social distancing, etc. But the other concern is going to be that people are going to be anxious and stressed. So the patience is not going to be there. So people are going to be angry. They can get angry. And if the situation is bad, it can become quite bad. All the people who have worked in public health for a long time are recommending to try to stay home and not to travel. I think it's difficult for the holidays. We're used to traveling and used to getting together with family during the holidays and Thanksgiving. But this year, we really need to consider changing the plans. If you do have to travel, if you do have to fly, ideally you want to try to get the first flight of the day when it's going to be the cleanest, and also there'll be fewer people at the airports. As the day progresses, there'll be more people at the airport arriving and departing, and planes are going to be more likely to be full. Planes themselves are actually safer than the airports. Newer planes, and most of our airlines have newer planes. The airflow within the plane is so good that the flow by 4 seats, they have their own flow, and it cleans and filters out germs. So planes are actually safer. However, what I do recommend is to keep the mask on at all times, even in the plane. Once you get to wherever you are going to seat, use wipes to wipe the surfaces, and then have hand sanitizer available. Some people are saying also to take your own food and drink. That way,
Yes.
it's safer.
So the couple of subjects I'm going to cover, would you like to share what's in your other travel bag there?
Those are just, so the other thing the health
And we're going to get back to COVID as soon as you
experts
get
are
done.
saying is that if you do get together as a family, then you want to be outdoors as much as possible. So I wanted to remind people problems with ticks. If you're going to be outdoors, with the warmer temperatures that we have, ticks are spreading to different areas. So if you're spending time outdoors, most likely you'll be covered. But at the end of the day, check yourself to make sure there are no ticks. First aid kits have those available. And then these are just slippers. If you go from the outdoors to the indoors, either take your shoes off and put these on, or cover your shoes with some plastic so you don't bring things in and out. So those are just some things that I brought. And then, of course, insect repellent. If you're going to be outdoors, especially here in South Florida, you want to use different insect repellents, either on the skin or on the clothes.
So there were some...
I have to show this.
Okay,
Sorry.
go ahead.
This is so cute.
Oh, here we go, folks.
Your own cup.
It's perfect. All these things, when you can get into the mindset of protecting yourself and your family, you realize that if your hands are here, it may be a while before you want on your hands as you keep touching people. When I go home, I walk in, I take off my shoes, I clean my phone, I go take a shower. That's the routine, all right? And I wash my hair, because you just don't know when, and my wife, by the way, she's probably only been out of the house 20 times since March, all right? Very protected, and we went out. She looked in a restaurant. She said, I'm not going in. I happened to stop by a local restaurant. Lunch, I looked inside. There was a table that was twice as long as this, and they were all friends. There were 20 people sitting at the table, closer than you and I are, eating, and I know it has to be in the air, all right? I joke, and I go with people, so the COVID only affects you when you're standing, all right? But when you're sitting, it doesn't affect you. It affects everything, right?
Right.
Let's talk about the different types of strengths, if you will, of COVID. Is there just one COVID, or there's some that are not as strong as others and some are a little weaker?
I just want to emphasize a point that you just made about the phone. We're always using phones. Most of us don't clean it as often as we should. So I wanted to emphasize that to our viewers. COVID-19 is one strain. However, it is mutating. It's part of a group called coronavirus. Coronavirus has many different strains in it. And in fact, one of the tests that was available even before the COVID came out, a respiratory test. In that test, we used to test for 3 different strains of coronavirus. Kids get something called hand, foot, and mouth disease, which is quite infectious. That's a coronavirus. So there's different strains of coronaviruses that could do different things. But COVID-19 itself is a strain that is different. It is mutating, and they have found that the original strain from China is a little bit different than the strain that was in Europe earlier this year. So it is changing.
So when we read about the gigantic numbers of people that are getting it, it looks like a huge majority of the people live without a particular problem. So, but the symptoms that people demonstrate when they have it can be this wide range. Some are asymptomatic, right? And then others get really sick.
Right.
So do you, when they have it, when they test you have it, can you tell which strain it is? And,
No.
and how does that
No.
matter?
No. And just going back to the testing, when there's different tests available, one is a rapid test where you get the results within a short time, within an hour or two. That test may not be as reliable as the PCR test, which is more likely to be positive, to be true positive, which is sensitive.
And what is that? How is that? How do you take it?
The PCR.
Yeah, how do they take that test? Or is it the same swab? Or is it?
So that was the other thing I was going to mention. There's different ways of getting the swab. There are some swabs that they just do in each nostril.
You mean back up in
and
your
the
head?
other one that's all the way back, which is very uncomfortable. But the one that's way back is the best one. Because in order to have a positive test, if it's positive, you need a good sample. If you don't have a good sample, then you can have a false negative.
So when I went to one of the stadiums and went to Joe Rock or whatever it's called, Hard Rock, they begged me to take the third test. So they did the blood, they did the nose, and then they did one in the mouth.
Right.
And they said the one in the mouth was for, what was that function? What was the purpose
There
of
was
it?
like a saliva test, and that would have been a PCR. So the advantage with the PCR is that if there's a small amount of virus, it'll show up.
But up here, when she knows, it wouldn't show up.
It would as well.
Oh.
Yeah, but it might be a different test, the different kind of PCR test. And then I don't know if you read, University of Miami is working on a breath test that they're going to be checking against the PCR test. So it's different kinds of tests and different chemicals they would use to get a positive test.
So I've been tested. I paid for several of them and some free ones because I was, when I kept coughing and then I was, is this okay? And I kept going and going and going. And so I feel comfortable that I didn't have it, all right? And I didn't want to be afraid of it. And I wanted to be able to urge people to do it, that it's not, you're not going to die from it. It's uncomfortable for a couple seconds.
Right.
And the county, the ones that I've been at the Tropical Park and the other one at the Hard Rock, it was perfect. They did it perfectly, all right? They put you into the chute. They would say, what are you here for? They would do the different tests, and they really took very good care. The issue, though, is in the time it takes to get it back. I'm a little hard of hearing, but I asked them, how long is it going to take? They said 2 or 3 hours. Well, that was one of them, all right?
Right.
That was the antibodies. So the other one took, actually, they didn't call me, they didn't send it when they said they would, so I called and they had it. They hadn't gotten around to sending it. So if you're out there testing, you can call them, and at least I got that answer. We had some adults over at our house. We said, in order to come over, it's family, you have to have do it on Thursday, you can come on Friday, but if it's, all right, that's what you got to do if you want to come to the house.
Yes.
And it was really, it may have not been, I think it was pretty medically sound, maybe not perfect, but it was pretty close to, what we wanted to do. So people are really concerned about this vaccine that seems to going to be on the market relatively soon, especially if you're over the age of 50, you say a couple months, 6 months is soon, right? It looks like only about half the population or less says, I'm going to take it. What is your understanding of the polls that are out there?
Before I answer that, I just have to make another comment.
Help yourself.
We're so focused on COVID that we're forgetting about other respiratory viruses that have been around forever. So, for example, when you got sick and it wasn't COVID, it would have been another virus that
Yes.
made you feel really bad and made you have cough and stuff. This time of the year, we're especially concerned about influenza and COVID because we know that influenza kills, and the combination of influenza and COVID can be a problem. So,
Just to make it clear, those are two different diseases that can happen at the same time.
yes, and that can be dangerous. So, at least we have the vaccine available for flu, which is a good one.
Yes.
So I really urge everybody, all adults and children, to get the flu vaccine. It's available.
Do you think Wayne should take a flu shot?
Sorry?
You think Wayne should take a flu shot? Wayne? Wayne,
He's already taken it.
Oh, Wayne, way to go, man. So, and they get flu shots. You can go to Walgreens, Walmart, wherever it is, CVS.
And there's different kinds of flu shots, but
Yes.
but everybody should get the flu shot. Regarding the vaccine, there are so many different vaccines that are out there. The one that Pfizer is coming out with has such good positive results. It's a RNA vaccine, which is a new technique, and it seems to be safe.
When people tell me, I want to have somebody else to take it, make sure I don't die from it. I want to say, some people are saying hello here. David Gonzalez, Robert Husted, Celeste, Sylvia, and Zoe Marin, thank you for checking in. So there's some people that say, I'm not taking any vaccine, all right? Well, and a certain percentage aren't, all right, going to do that. Well, I'm going to tell you, I'm taking it, all right? Because, listen, I'm too old to be screwing around with this stuff. You know, you're going to take it, and yes, I want to wait a little while, but and I had already said to my wife, I said, when I take it, I'm going to tell you and the kids goodbye in case something happens. But I know that we as Americans and we as human beings need to get to the other side of this thing. And whether it's in 3 months or 6 months or a year and a half. And I think that we as people, as we can do things, starting from wearing your mask and cleaning your hands, that's part of the protocol to getting back so we don't have to have this. 2 years ago, if somebody was like incessantly washing their hands and doorknobs, and I go, what's wrong with them? You know, and so in the bathroom, I always figure out a way not to open it.
Right.
And then now I tell the guys, said, if there's not a garbage can by your door, I'm throwing the paper on the floor, right? So make sure it's there,
Right.
right? And make sure it's nearby. We just had somebody here, she was going to the building, whatever door she goes to, right? She has a thing, great. Happy, all right? So what percentage of people in the United States have to take the vaccine in order for a lot of people to be protected?
So what you're talking about is herd immunity, which
Yes.
is not.
Is that a real statement? Is that a real
It's something
thing?
that we don't really know. There was hope that if enough people get the infection, then there would be herd immunity. When the vaccine becomes available, it's not going to be available for everybody. It's going to be available for those who are at high risk, the elderly, maybe people in nursing homes, and people with chronic illnesses. So that's not going to be that's not going to be enough population vaccinated to lead to herd immunity. The other thing is that all these vaccines are new. So we don't know how long the immunity will last after the vaccine. For example, yellow fever vaccine. In the old days, it used to be thought that it's good for 10 years, but now they find that it's good for life. So you get one vaccine and you're good for life. Influenza, we have to take the vaccine every year. So with the COVID vaccines, we don't have long-term data. We do have data now that the Pfizer vaccine is safe and it gives 90% protection.
That's pretty good, 90%.
But we don't know how long that protection is going to last. And that's something that I'm sure studies are going to be ongoing. They're going to be checking antibodies.
I'm going to throw out a couple of figures. 3 months? 6 months? A year?
It's hard to tell. I consider, remember that the Pfizer vaccine, it's a series of 2 injections. You
Yes.
get one now and then another one later. The second one is a booster. The fact that they have 90% antibodies, I would think that that's going to lead to longer immunity. I don't have the experience to say
By the
how
way-
long, but I would say at least a year.
At least a year. I see Wayne Bracken wrote up there, I always listen to Dr. Mavunda. Did I get that right? Okay. Hey, Mr. Bracken, how are you? Go Kids Medical Services. Yes, sir. Hey, Bob. All right. We probably had 15 doctors talk about COVID. You clearly know what you're talking about. the most experience, and you speak from personal knowledge, and you've done this type of thing for your entire life, right? Pretty much.
Many years.
For many years. We're at the place where we can say that, all right? So what does our life look like come next Christmas here in Miami-Dade County?
Next Christmas is going to be better than this Christmas.
I hope so.
We have, just imagine how much we have learned this year about COVID.
Yes.
You know, we were talking earlier about the testing and how the results were not available because the system was overwhelmed. Now we have better tests that are more accessible, so we'll be able to test better. People will have learned. We have gotten into the habit of using masks and hand sanitizers,
Yes.
which we should
Yes.
be doing frequently. I don't know if you remember much about the H1n1
No.
epidemic that we had, pandemic actually, many years ago. The medical community has been very concerned about a bad influenza virus coming into the world that's going to cause a huge pandemic. And when the H1n1 came, people were really panicked, and fortunately it wasn't as bad as we thought it would be. But one of the things that we learned, and I see little kids doing it, is they always cough in their arm. You hardly see people coughing, just coughing. So that's H1n1. Many years ago we got into that habit, and that habit has stayed. The number of respiratory viruses is going to continue increasing. So even if we take care of COVID, even if we get immunity against COVID, there are going to be other respiratory viruses that are going to show up that can cause the pandemic, another pandemic. So this habit that we get into with the masks, the hand washing, those are good habits that we're going to need to continue. One of the reasons that Asia has done so well is because they're used to wearing masks. And they are very good about isolation and quarantining and all that sort of thing.
Yeah.
So our lives have changed. They will remain changed, but they will be better.
Thank you for that, and it's very encouraging. Prior to March, we had some people here that constantly had colds. And then now, no colds since they're not here. Because you realize now, when you look at it, go, oh, they would give it to this one. It would go around like this. Oh, we didn't think it was a big deal. But it was just constantly somebody had it and giving it to the next person. A couple of years ago, there was, I forget the disease that mosquitoes give. What is that disease? When there were mosquitoes?
Oh,
Zika. Was it Zika?
So that's another thing I love to talk about. The same mosquito that transmits Zika transmits dengue fever and chikungunya and yellow fever. So we had Zika that came out, but we have dengue. We had locally acquired dengue in the Keys.
So when we would, as a consumer of information news, I would say, okay, there's only outbreaks on Miami Beach. And I go, well, so don't the mosquitoes, don't they fly? They get carried by wind and go everywhere? And so, unfortunately, I stopped believing that. I go, no. It's everywhere else is safe. No, you can't. That can't possibly be it. But there are still people around the country that think that COVID isn't a real thing, all right? And that they don't want to wear masks, all right? Like those 20 people sitting in the restaurant. That would never happen with me. It would be like, no. So you can see it in the restaurants where you know that it's going to happen, all right?
Right.
It has to happen. So you said next Christmas is going to be better, all right? But when how long will it take once vaccines start to be given? I see the state of Florida might be getting 3 million injections, all right? I don't know if that means only half of that or whether that's 3.5 million people, all right? We have 20 million people in the state of Florida. What percentage of what percentage of people do you think ultimately will take the vaccine?
if there are people now that believe that COVID is a fake thing, those people are not going to take the vaccine
Yes.
because it doesn't exist. COVID doesn't exist. So, unfortunately, I would say 50% will take it and 50% won't.
Okay. So, and what percentage of people take flu shots, vaccines?
70% this year.
Because
the
of COVID?
past,
Because of COVID?
Yeah.
It increased.
Compliance with the flu vaccine is much better this year. But in the past, maybe 30 to 40% in the community.
Because they got scared with COVID.
And all the advertising we're doing. And a lot of physicians, pediatricians are pushing the vaccine also. I remember even 3 years ago, there were babies that were told, oh, you don't need the vaccine. But now physicians believe in the vaccine, and if the medical professional recommends it, they're more likely
So
to
my
believe.
GP
Getting the same message from different people helps.
And yes, and I think that's one of the things that we've been lacking as far as a deliberate, consistent message
Yes.
from everywhere, local government, statewide,
Right.
regionally,
Right.
nationally. And it was the other day somebody in Washington said, "Wear your masks."
Yes.
Right? Thank goodness. All right. Because we are looking for some direction with this, and that was a challenge that I would get when I would talk to people. They say, "Well, okay, the county's doing this, and the governor's doing this, and we have Broward County is different than Dade County
Yes.
because they're doing bars and this, we're not doing it." Very confusing for people. But it is real. I mean, 146,000 people got COVID reported yesterday.
Yes.
Dade County, in particular, in Dade County. I know it's ticking up. It went a little bit below 5. So now I'm hearing figures 7, 8, 9%. And that's for positivity. I mean, the people that were tested, let's use
Right.
figure 7%. 7% of the people that got tested. And then there's a number that comes out of that. But only a certain percentage of the people are getting tested.
That's the thing.
So the percentage may be the same, but the number of people is not. I don't know what percentage of people in Dade County are getting tested. It looks like there's more. I think people are getting a little more concerned.
Yes.
So, again, thank you very much for your time. You're a real pro at this, and I'd like to invite you back in a couple of weeks. All right, maybe right before Christmas. All right. So let's hear
After the vaccine, after
Okay.
we have more data about
Okay,
the
good.
vaccines.
So let's hear your suggestion concerning people getting together for the holidays. And talk right to him right there, because you might save a life today.
Stay in small groups. One of the things that I have been thinking, and maybe I should not say it, but I will. If you do spend time with the family and you are going to have a bigger group, what would be important is to have your own pods. So each family should isolate themselves for a week to 2 weeks prior to the get-together so that they are negative with COVID, whether they get tested or not. If they are isolated, then if you have one isolated group that gets together with another isolated group and they're still careful about maintaining the space and good hand washing and wearing masks when not eating, it may be possible to be together. But the space is important. Unfortunately, here in Miami, the weather's going to be nice. So spending time outdoors would be good. It becomes a problem when you have to travel. If you have to travel by plane, then you're putting yourself at risk, you're putting other people at risk, and the people that you're visiting, you're putting them at risk. So you really need to think about whether you want to travel and risk other people getting sick, or you want to stay at home, and thank goodness for Zoom and other things that you can still see each other and communicate. If it's short distances and driving by car, that would be okay. But when you drive, if you have long drives, fatigue can be a problem. The way people drive sometimes can be a problem, getting into an accident. But then if you have to stop at bathrooms, which are public spaces, then again you're increasing your risk of getting exposure. So especially this year, really think about whether you want to travel. Stay home if you can and stay in small groups. It's going to be worth it in the long run.
So, folks, holy moly, you just heard it here from the good doc. I want to say hello to a couple people. Liberty Betancourt, Josmir Torres, Elaine Perry Roundtree, Marcos Garcia, Dan, can't pronounce your last name, and Jefferson Cyrus saying hi again. Again, thank you so much, Doctor, for coming.
It's a pleasure.
And our guest is Dr. Tell us again, pronounce it correctly.
Kunjana Mavunda.
So there you go. And thank you, Tommy, for producing the show. And folks, again, this is Live with Miami's Community News. Be safe out there and have a great day. Bye.